So some people might be wondering what a double board certified facial plastic surgeon is. Hi, I'm Dr. Sarah Saxon. I'm a double board certified facial plastic and reconstructive surgeon in Austin and Dallas, Texas. And I'm here to explain in this video what exactly is a double board certified surgeon. So for facial plastic surgery in particular, it is a subspecialty of ENT, otherwise known as otolaryngology, or also otorhinolaryngology, head and neck surgery. So there are a lot of different ways to refer to that specialty. There are a lot of specialties in that particular discipline. If you think ENT, it's everything from the clavicles up besides the brain and the spine. You have the sinuses, you have pediatric ENT, you have laryngology or voice surgery, you have allergy and sleep medicine, and of course facial plastic surgery. There's also a head and neck cancer specialty as well, and skull-based surgery. So there's every aspect you can get as detailed as possible. Way in the past, ophthalmology was actually included in otolaryngology. They split off decades ago, and so now ENT is its own entity. Otolaryngology is a 5-year residency outside of medical school. So anyone going into facial plastic surgery first has to have a 4-year college degree, and then goes to medical school for an additional 4 years, and then residency for another 5 years. And if you want to subspecialize into facial plastic surgery, it's a 1 additional year of facial plastic fellowship. Now, it's not saying that you're not doing facial plastic surgery all through your residency, because pretty much every day in an ENT residency includes facial plastic. So we do facial trauma, we do congenital anomalies of the face, but everything else, both functional and cosmetic. Anytime you make an incision in the face, it has to be cosmetic, because whether it's a cancer surgery or not, like, you don't want them to experience any deformities from that scar. You don't want them to have any functional problems. And so facial plastic surgery is a specialty that's very intense on both the aesthetic and functional aspects of the face and neck. Once you're finished with your training, while you're in fellowship, you actually do your board certification in ENT. So that means you take a written board at a testing center that you study many, many months for. And once you pass that, you can go on to oral boards, meaning it used to be you go to a hotel and go from room to room, and you have other surgeons, peers, give you patient scenarios, and you have to go through what you would do in each scenario. Now that's all virtual on the computer after COVID. They figured out how to do that. After you complete that, then you have your facial plastic boards. And that is both a written and oral board, same as ENT. So you take a written exam in a big room with all the other facial plastic fellows, and then an oral board basically the following day. That still doesn't mean if you pass both the oral and written boards that you're board certified in facial plastics, because you still have to collect a certain number of cases in certain categories for 2 consecutive years. You have to compile all those cases and send them off to a committee who reviews all your case numbers, looks at the operative reports that you sent in, and then scrutinizes them line by line to make sure that you are qualified to be board certified in facial plastics. So it's a long process, but well worth it. And if you find that you're going to a surgeon that doesn't say that they're board certified in facial plastic surgery, there's a number of different ways they could have gone about being qualified to be a plastic surgeon of the face, but a facial plastic surgeon is specifically qualified to treat you in all aspects of functional and aesthetics of the face. Again, I'm Dr. Sarah Saxon, double board certified facial plastic surgeon. If you want to follow along in everything we're doing in the office, give us a follow on Instagram at SaxonMD. You can also go to our website at saxonmd.com.